everything labor and delivery related was $59,710.
That's insane. Thank the Lord we have insurance.
Grand total for me to give birth was $144,000.
New moms all over social media are breaking down their incredibly expensive hospital bills after giving birth.
When we checked in, my husband joked with all the hospital staff that this would be the most expensive hotel stay of our lives, and he was not wrong.
So why is giving birth so expensive in the US? And given the Trump administration's anti-abortion, pro-natalist policies, is there anything on the table to make having a child more affordable? To answer these questions, let's start with a quick history lesson, beginning almost 50 years ago. The Pregnancy Discrimination Act of 1978 prohibits discrimination based on pregnancy, childbirth, or related medical conditions. Before that, legally, you could have been fired or had your benefits stripped because you were pregnant. Then by 1990, Medicaid was expanded to cover low-income pregnant women. Today, Medicaid covers more than 40% of all deliveries. The Congressional Budget Office, however, estimates that President Donald Trump's flagship budget law would reduce Medicaid spending by an estimated $911 billion over the next decade. Beginning in 2022, 49 states extended postpartum Medicaid coverage to a full year, up from 60 days.
We know that complications occur in the postpartum period that can lead to higher costs. So that felt like a key intervention to support families. I'm very nervous about what might happen with these large Medicaid cuts that have been proposed.
When the Affordable Care Act was signed into law in 2010, maternity care was included as an essential health benefit. So employer-based insurance plans were required to cap out-of-pocket spending on maternity services. About half of births in this country are covered by commercial insurance. But the cost for co-payments or deductibles before plan coverage begins can add up. Some parents are even required to prepay for childbirth by their doctor's offices. I asked OB-GYN Malini Nijagal, where do the highest costs come from?
The most costly part of childbirth is associated with the hospitalizations.
Often, patients' insurance covers the bulk of the cost, but not always. It can be a roll of the dice.
We are very focused always as people on our out-of-pocket costs, but what we forget is that often the costs that insurers have to pay, that ultimately gets passed on to us as well.
If the cost goes up, the insurance companies increase the premiums, and often consumers pay for that increase. People who give birth see an average of nearly $19,000 in additional health costs, including almost $3,000 paid out of pocket.
I have patients who will start asking me about the impact of what I am recommending as care on their hospital bills. I recently had a patient who was trying to decide between a vaginal birth after a prior cesarean versus having a repeat cesarean section, and she was asking me that question about which one would be more costly. We actually do have an answer to that because we know that cesarean deliveries are charged more to the health insurance company.
One study shows postpartum women have more medical debt than other women, which could affect maternal health and the welfare of young families.
After they have just welcomed a new baby into the family, it puts further stress and strain on the family, and they may be more likely to forego necessary medical care for the parents or the children.
The U.S. fertility rate has been declining overall since the 1950s, hitting an all-time low in 2023. The pro-natalist movement, which believes that this falling birth rate will ultimately lead to economic demise and even the apocalypse, has been elevated by President Donald Trump. And Trump has voiced support for a $5,000 baby bonus and even a motherhood medal. But $5,000 isn't always enough to cover the hospital bills that come after giving birth. Some countries like South Korea and Singapore are offering cash incentives to combat plummeting birth rates. In May, bipartisan legislation was introduced in Congress to require private insurance to fully cover childbirth. We'll see if that goes anywhere. But the root of the cost question starts well before going into labor.
The number one way to address increasing childbirth costs is to invest in pre and post-hospitalization. So again, we really need to focus on how do we decrease complications of childbirth that end up being costly, and how do we avoid additional hospitalizations.
Nijagal says investing in things like doulas and comprehensive care programs could help. We'll continue to follow this issue. For the latest health policy news, you can visit our site, kffhealthnews.org.